My son's mental health challenges began around the year of 2001, 2003, and it started with a drug-induced psychosis. We ended up basically getting tossed from pillar to post and hospital to hospital and not getting a correct diagnosis from the beginning.
I was diagnosed schizophrenic affective in 2003 and currently have been locked in facilities in and out of rehabs, drug rehabilitation programs since 2003. I actually have been self-harming myself for 9 years now, and ever since I was 22.
As a parent in this system and as a health and human service worker for 30 years, I would have to say my son has been one of the highest risk psychiatric clients that I've seen in the system in the 30 years that I've been there. And with the professional capacity of the people that I deal with, many times I find myself separating myself as a parent to put the professional hat on again so that I can help and communicate with staff, with doctors, and with agencies what the needs are. If I did not have that training and I did not have the capacity as a parent, we may very well have been lost in the mental health system years ago. I have a saying that I like to say, schools don't teach, hospitals don't heal, and prisons don't correct, people do. And I just really believe that building the relationships between professionals and clients and agency directors and the relationships that those folks have are crucial to any client coming through the system. We have encountered stigma in regards to mental health diagnosis. First of all, not having a correct diagnosis or being fearful of a diagnosis. You're also limited in rural areas for the stigma and for the lack of understanding of mental illness and how we can actually address mental illness with wellness, strength-based approaches rather than a disease. So the stigma is a lot the fear that is involved in people really don't know or understand, and even some of your best, brightest professionals don't know and understand some of these phenomena and how to best deal with the phenomena of mental health stigmas in a best practice, research-based evidence approach. I believe being a Native person has actually helped the experience in regards to mental health because we have a holistic, comprehensive view of clients and a comprehensive view in our community of how culture and mental health and spirituality and the body all fit together. So it's actually helped us in the way that we think and being able to communicate that to providers and to systems, to facilities, to doctors. We've been able to access more resources and we've been able to address the spirituality and the culture that helps strengthen the process of healing and recovery and wellness for the mental illness.
If you can get on the right meds and you stay on your meds and stay away from dope, then you have a good chance of being a working part of society and able to do things that normal people would be able to do. In 5 years, I see myself out of a facility, a locked facility, and being a productive member of society and enjoying life and living life on life's terms.
Absolutely don't quit, don't give up, don't take no for an answer. You know in your heart what your family needs, what you need. You know yourself better than anybody else. Make sure that you have a voice and that you keep a voice throughout the whole system and throughout the process of what it's going to take to reach that level of wellness for yourself, for your family, and for your loved ones.